Your dog just licked you. Same spot. Again. Maybe it is your ankle. Maybe the inside of your wrist. Maybe a patch just below your knee that they keep coming back to day after day, with a focus that feels different from their usual greeting licks. And you let them, because it feels like affection, because you assume they are just being a dog. But there is a category of licking that has nothing to do with love, nothing to do with bonding, nothing to do with the salt on your skin or the scent you picked up from outside. There is a type of licking that is your dog's only available way of telling you that something is wrong. And most owners miss it entirely. Not because they do not care, because no one ever told them what to look for. By the end of this video, you will know exactly which spots matter, what targeted licking actually signals in a dog's body and brain, and the one pattern that means you need to stop what you are doing and pay attention right now. We are starting from the beginning.
1. Not all licking is the same language. Dogs lick for dozens of reasons: reunion, appeasement, self-soothing, investigation, affection. Each one looks slightly different if you know what you are watching for. But the licking that most owners misread, the one that sits quietly in plain sight for weeks before anything becomes obvious, is targeted licking, repetitive, focused, returned to again and again with an almost compulsive consistency. This is not your dog saying hello. This is not your dog reading your scent after a long day. This is your dog's nose doing something it was built to do, at a level of sensitivity that no human instrument has yet been able to fully replicate. A dog's olfactory system is estimated to be between 10,000 and 100,000 times more sensitive than a human's. They do not just smell the surface of your skin. They smell beneath it. The compounds your body produces, the subtle chemical shifts that occur when something inside you begins to change. And when they find something, they come back to it.
2. The spot matters more than the lick. If your dog licks your face during a reunion, that is emotional. If your dog licks your hand the moment you walk through the door, that is investigative. If your dog licks your arm once while you are sitting together in a quiet room, that is probably comfort or habit. But if your dog returns to one specific location on your body, the same patch of skin, the same wrist, the same calf, the same side of your neck, repeatedly, with a focus that feels deliberate rather than casual, that is different. That is a dog who has found something they cannot stop finding. Medical detection dogs trained in clinical settings have demonstrated the ability to identify certain cancers, detect blood sugar changes in diabetic patients before symptoms occur, and alert to oncoming seizures, sometimes up to 45 minutes before they happen. They do this through scent, through the chemical signatures that the human body produces when something inside it shifts. Your dog is not a trained medical alert animal, but they carry the same biological hardware. When a dog returns to the same spot on your body with focused, repeated licking, they are not malfunctioning. They may be trying to communicate something they have no other way to express.
3. What the research actually shows. A study published in the journal PLAWS One examined the ability of dogs to detect lung and breast cancer through breath samples with an accuracy rate of over 90%. Separate research from the Pine Street Foundation documented dogs identifying ovarian cancer from blood samples with similarly striking results. These are not outlier findings anymore. The volume of peer-reviewed work on canine scent detection and human health is growing year by year. What makes this relevant to you is not that your dog is scanning you for disease every time they lick your hand. Most licking is not that. Most licking is everything else we already talked about. What makes this relevant is the pattern, the consistency, the return. A dog licking your hand once is not a signal. A dog returning to your left wrist every single evening for 2 weeks with focus, with persistence, with a behavior that feels qualitatively different from their usual contact is something worth noticing. 4. the spots owners most often ignore. The locations dogs tend to return to when something is medically relevant are not random. They gravitate toward areas of the body that are rich in surface veins, glands, or where skin is thinner and chemical signals are more accessible. The inner wrist, the crook of the elbow, the side of the neck, the ankle, the area behind the knee. These are not the places your dog usually licks for affection. Face licking is emotional. Hand licking is investigative. Returning to the inner wrist for days straight is something else.
Pay attention to whether the licking is bilateral or one-sided. A dog sniffing and licking both your ankles after a walk is reading the environment you came from. A dog who only ever returns to one specific ankle on one specific side is responding to something localized. Location asymmetry is one of the clearest behavioral flags you can observe without any medical training at all. 5. When it is not about you, it is still a signal. Targeted licking does not only point outward. Sometimes a dog licking the same patch of their own body, a paw, a flank, a spot on their leg, is equally significant. Licking that changes fur color, that produces a wet, matted area called a lick granuloma, or that causes visible skin irritation is not a behavioral quirk. It is a dog attempting to manage discomfort they cannot verbalize. Skin conditions, joint pain, nerve sensitivity, allergies, and anxiety that has no other outlet all manifest this way. The licking provides minor, temporary sensory relief, which is why the dog returns, which is why it escalates, which is why that fur begins to thin or darken, or the skin beneath becomes raw. A dog who occasionally licks their paw is a dog. A dog who licks the same paw at the same time every day until the fur turns rust-colored from saliva saturation is a dog in low-level chronic discomfort, asking for help in the only way available to them. 6. The thing to do right now. You do not need to panic. You do not need to assume the worst, but you do need to start watching with a different level of attention than you had before watching this video. Notice whether the licking is consistent, whether it returns to the same location, whether it happens at specific times, after specific activities, or without any obvious trigger. Notice whether your dog seems calm during the licking, or whether their body language suggests something more compulsive, ears slightly back, eyes softened, a rhythm that does not stop when you move away. Notice whether the spot they return to is on you or on themselves. Both are information. Neither should be dismissed as habit. If the behavior is new, recent, and focused, mention it at your next vet visit. Not as a dramatic emergency, as information. Your vet cannot act on what they do not know about, and you are the only one in a position to observe your dog's behavior across days and weeks. The most important thing you can do for your dog is pay attention at a level of detail that most owners never reach. Not because something is always wrong, but because the one time something is, early attention is everything. Your dog does not have language. They have behavior. Every repeated behavior is a sentence in a language that most people were never taught to read. You just learned one of its most important words. This channel exists for exactly this reason. Not to tell you your dog loves you. You already know that. But to give you the tools to understand what they are actually saying when they do the things you have been watching and wondering about for years. If this video gave you something, a shift in how you will observe your dog starting today, hit subscribe and tell us in the comments, is there a spot your dog keeps coming back to? A behavior that never quite made sense until now? We read every single one.